The Keeping Nurses at the Bedside Act is a bill designed to address the hospital short staffing and retention crisis that hospital CEOs have created and that is driving nurses away from the profession while hurting patient care. While the new contract we fought for may help stop already poor staffing levels from getting worse, only legislative action can solve the crisis of care patients are experiencing every day in our hospitals. Contract language on staffing varies from hospital to hospital and only covers M&A represented hospitals. This bill will stop the current piecemeal approach to patient safety and nurse retention. The Keeping Nurses at the Bedside Act, or KNABA, currently includes provisions that would address the crisis of understaffing and retention in Minnesota hospitals. 1. The bill establishes nurse staffing committees to set staffing levels. The bill requires all hospitals in the state of Minnesota to engage direct care workers in producing core staffing plans for each unit at every facility. It creates a joint staffing committee which would set a maximum limit on the number of patients that any one nurse should safely care for. This flexible, hospital by hospital, unit by unit approach will allow hospitals to set and adjust staffing levels that work on a local level based on the expertise of bedside nurses. 2. The bill requires plans to eliminate boarding in emergency departments. It requires the new staffing committees to create a plan to eliminate patient boarding in emergency departments without mandating that staff work increased hours to cover for hospital understaffing. 3. KNABA ensures charge nurses do not have individual patient assignments. KNABA requires the new staffing committees to create plans to ensure charge nurses can be a resource for patients and other nurses, to help mentor and train newer nurses, provide urgent assistance, and help to meet the needs of all patients on a unit without the burden of taking on individual patient assignments. 4. The bill requires hospital transparency. It directs the Minnesota Department of Health to review hospital data on patient care and staffing to produce an annual report grading Minnesota hospitals on whether they follow their staffing plans. It would also require hospitals to post waiting times for emergency departments and to provide up-to-date unit staffing information to patients when they arrive at the hospital and throughout their stay, so they know the size and scope of their care team. 5. KNABA helps prevent workplace violence. The bill mandates more robust workplace violence prevention plans and training for all healthcare workers in hospitals. 6. The bill retains and sustains Minnesota nurses. KNABA requests $10 million in permanent funding for mental health grants and allocates $5 million to create a new student loan forgiveness program for nurses working at the bedside in Minnesota. 7. It recruits and trains nursing students. The bill dedicates resources to ensure we continue to attract and train a skilled and diverse workforce of registered nurses in Minnesota, including broadening an existing student loan forgiveness program to incentivize nurses to become nursing instructors and allowing scholarships to cover childcare costs for students pursuing a nursing degree. There are a variety of opportunities to get involved, including participating in the legislative town hall, attending a mini day on the Hill to speak to legislators about the importance of the bill, contacting your legislators directly from our website to share why the bill is important to you, testifying at the Capitol during a hearing for the bill, telling your coworkers about the bill and encouraging them to get involved too. Visit mnnurses.org/KNABA for more information.